Good morning. My name is Aryan and today I'm here to talk to you about myeloma, a term taking its root from Greek with myelo meaning marrow and oma meaning tumor. Hence, simply put, it is a marrow-based cancer specifically affecting our plasma cells. You might have heard of renowned actress Dwivedi famously suffering from multiple myeloma. Yet, she's far from the only one, with a prevalence of 0.7 per 100,000 people every year in India, translating to 7,000 cases per year, contributing to making myeloma the second most common form of blood cancer across the world. What's worrisome about this disease is that a meager 49% of patients hit the 5-year survival mark. Yet, with time, the medical fraternity has devised novel therapeutic options, and today I'm here to talk about an exciting and emerging therapeutic option, monoclonal antibodies. But let's back up. What are antibodies? Well, antibodies are simply substances that help our body fight off against antigens, and antigens are adverse substances that induce a cellular response by the immune system in our body. Monoclonal antibodies are artificially produced clones of specific antibodies that then react against specific antigens. So let's have a look at the mechanism of action and working of monoclonal antibodies in myeloma. Up on our screen, we see a malignant plasma cell and an antibody with light and heavy chains. Attached to the malignant plasma cells are specific antigenic protrusions to which the antibodies eventually get attached. They then initiate a process called apoptosis, which in this case is a form of beneficial programmed cell death that eventually leads to the elimination of the malignant plasma cells. But you might wonder, how are monoclonal antibodies superior to other therapeutic options? Well, the answer to your question is a four-pronged one. Firstly, monoclonal antibodies are highly specific to only cancerous cells, unlike chemotherapeutic drugs which are generalized in nature. Owing to this specificity, there is reduced toxicity and hence lesser side effects that monoclonal antibodies entail. It is also to be noted that therapy with MAbs is of a shorter duration and may entail a shorter course as compared to chemotherapeutic drug regimens, which may go on for months or even longer. I also point out to you that monoclonal antibodies can be utilized as adjuvant first-line therapy or in the case of patients that have not responded to other forms of therapy against myeloma. But there is a catch. The novelty and sophistication of monoclonal antibodies does serve as a dual-edged sword. While these factors lend it its efficacy, it is also to be noted that it is an expensive commodity, with one session currently costing around 60,000 rupees. However, as this mode of therapy is widely adopted, it is likely that production would go up and costs would come down. Hence, we can be cautiously optimistic about monoclonal antibodies as we look to our future in the battle against myeloma. Thank you.